Okay, we are going to go ahead and start our briefing for March the 11th. And I want to wish everyone a good morning. We actually have a lot to announce. I know that we're streaming this. And so I want to just thank everyone for watching. Today we have an important announcement for the community. And then we also, I know for some of our media partners that are here or that are streaming this, we want to make sure we get all this information out about a bunch going on in the city as it relates to the COVID-19 vaccine rollout, kind of what's happening next with some announcements today, and then also what we're doing as it relates to moving into the red tier. So I do have a lot of information for the community, and we can answer any questions. Let me start by saying that we're here at the Kress Market, which actually opened back in 2010. Both Javier and Hilda, I know, are here somewhere. They're who own this place, just a great, amazing Long Beach couple who have put their whole life into this amazing place. And I was here when it first opened, and we are very grateful that they are part of our food community and have a fully vaccinated staff. We have actually vaccinated over 10,000 food and grocery workers in the city of Long Beach and have offered this vaccine within the food industry to almost everyone that wants one. And so we continue to get folks coming in, but that's been a really great development. We also want to provide some updates as far as where we are. Everything is going in the right direction. Our cases are down. We used to average 31 cases a day. We were averaging 740 cases a day. We're down to 31. Our hospitalized rate, which at one point was at 304, is now down 48%. Long Beach area hospitalizations are down 88%. And our positivity rate has gone from 17.4% to 2.3%. So really dramatic changes. We know we've lost about 879 people to COVID-19. So it's still a serious pandemic, but every indication has been going in the right direction. And we are reaching some important metrics. So I want to start today by talking about what's next as it relates to reopenings safely. It's important to note that Long Beach has, of course, maintained a data-centered approach, and that we have been following the advice of our health department as it relates to reopenings. We expect that Long Beach is now going to be moving into the red tier, and this we can expect will happen in just the next couple of days. The state has announced that there are different equity metrics that have been put in place now that has moved up that ability for us to open up here in Long Beach sooner. LA County, which of course includes Long Beach, will be in this less restrictive red tier in days, not weeks. Our city health department is actively planning for this move, and so what we want to let the community know is that within the next couple of days, it could be as early as we might know from the state as early as this evening. The state might notify us tomorrow or the next day that we will be moving into the red tier. What does that mean for Long Beach? Our health department feels very comfortable with aligning with the state's red tier recommendations. And so we will, with some modification, there will be some implementation differences perhaps, but overall, broadly speaking, this is where Long Beach will be. Retail will be moving from the 25% to the 50% capacity. Museums and aquariums, which have been generally closed, will be moving to 25% capacity in Long Beach. And I know this is really important for our museums. Movie theaters will be allowed to begin to open with a 25% capacity or 100 people, whichever is fewer. Fitness centers and gyms will be able to do some limited indoor training at about 10% capacity. And restaurants will be allowed to open indoors with a maximum of 25% capacity, along with the outdoor dining that's already in place. We're also going to ensure that there will be rules and regulations as it relates to restaurants and these other facilities as far as distancing inside, PPE protocol. So there will be additional requirements that are put in place, just like we did for the outdoor seating. That is all red tier. And the Long Beach Health Department has made the decisions, of which I support, that we'll be moving in that direction. And it could happen in the next couple of days. We want our restaurants to be prepared. We also want folks to know that effective April 1st, the City of Long Beach will be looking at outdoor live events that may occur pursuant to our Safer at Home order. And those, of course, will be limited in capacity, but we will begin to work with organizations that are trying to do these outdoor events. Again, we want to thank the restaurants, the retailers, the business community for being patient and for staying healthy, because Long Beach is becoming a much healthier place. Now some announcements on vaccine distribution. I want to let people know that, of course, the Johnson & Johnson vaccine is now here, and Dr. Davis is going to discuss it. We also want to let folks know that we have nearly completed the entire education sector in the city of Long Beach, and we are getting few requests at this point for educators, but that's great news. And our school district will be the first to open this upcoming March 29th in the state as far as large urban school districts. We also want to let folks know that of eligible adults, so essentially folks that are eligible, we think we're probably close to 23% of eligible adults have been vaccinated in the city of Long Beach total. And that, of course, is folks over 16. And we want to also let folks know that we do have some announcements. We are beginning today and tomorrow. Today, we are adding some essential workers that have been, we've begun to add some throughout the week. There's an expansion of the essential worker category. We're beginning transit workers, so everyone that works at Long Beach Transit or is involved in transit. City workers began earlier this week in different categories, began getting the vaccine. We're also vaccinating airport workers at the Long Beach Airport, or folks that work in aviation, and janitorial and custodial as well. And probably and most importantly, beginning tomorrow, which is ahead of the allowed date, we will begin fully vaccinating people with underlying health conditions. So we know that a lot of jurisdictions will have the ability to start those on March the 15th. Others are waiting a little bit beyond that date. We're going to start people with underlying health conditions, anyone above the age of 16, starting tomorrow. Later today, the city will release who qualifies in that group. It's all listed, will be listed on the website and in the state guidelines. But we want folks to get vaccinated right away if you have any underlying health conditions. So finally, and before I turn this to Dr. Davis, I want to just also note that the city has essentially completed the entire VAXLB notification system of the current eligible groups. And so it's been a huge success for us. We are now emailing and texting folks that we've emailed once, twice, or 3 times within those eligible groups, which is really great. It's been a successful system for us. And of course, now we're going to be transitioning with the rest of the state to the state MyTurn system. It's starting going into this weekend. We're going to start feeding folks into MyTurn. And if you're already in VAXLB, we will still use it to notify you when your turn is up. But we are switching to MyTurn, and the entire state is going to be going to the MyTurn system. That is everything that I have from a vaccine and numbers update. I'm going to turn this over to Dr. Davis, and then we can answer any questions if there are any questions on what we're doing. So, Dr. Davis.
Thank you, Mayor. Good morning. So today I'd like to share a little bit about the Janssen vaccine and provide you some updates to our quarantine order. The Janssen is a pharmaceutical company owned by Johnson & Johnson. So you'll hear all of those names be used for this particular vaccine. Last week, we received our first allocation of the Janssen vaccine, which contained 4,100 vaccine doses. The Janssen vaccine is approved for use for people aged 18 years and older and is proven to be highly effective and highly protective against severe COVID-19 illness and death. The single-shot vaccine is less temperature sensitive than the vaccines offered by Pfizer and Moderna and can easily be stored before mass distribution. I encourage everyone to take this vaccine if offered because the best vaccination to take is the one that you're first offered. So now to turn to some new guideline updates. Many people have been asking what they can do now that they've been fully vaccinated. The Center for Disease Control and Prevention has recently made some guidelines specifically for people who have been fully vaccinated that I'll review now. These guidelines will also be reflected in our upcoming health order. For clarification, a person is considered fully vaccinated if the following conditions are met. It's been at least 2 weeks, so 2 or more weeks since they received the second vaccine dose in a 2-dose series, which is the Pfizer-BioNTech or Moderna vaccines, or it has been at least 2 or more weeks since they received the single-dose vaccine, which is the Janssen vaccine. As you may have heard, on March 9th, the CDC released its first set of public health recommendations for fully vaccinated people in non-healthcare settings. These guidelines only apply to private settings, like your home. They don't apply to public settings, they don't apply to work settings. So fully vaccinated people in private settings can visit with other fully vaccinated people indoors without wearing masks or physical distancing. Fully vaccinated people can also visit with unvaccinated people from a single household in a private setting who, provided that these unvaccinated people are at low risk for severe COVID-19 disease. They can visit indoors without wearing masks or physically distancing. And just to review, people at lower risk for severe disease are those who are younger and who don't have underlying health conditions such as high blood pressure, diabetes, obesity, or are current smokers. Being older or having one of these underlying health conditions puts you at higher risk for serious illness from COVID. And you and everyone around you should continue to wear masks and physical distance for the future. So to review, this guidance only applies in private settings. It does not apply in healthcare settings, and it also does not apply in public settings, such as parks or workplaces. And it's important to remember that fully vaccinated people should continue to take precautions in public. They need to continue to wear a well-fitted face covering, practice physical distancing, avoid medium and large gatherings, and get tested if you're experiencing COVID-19 symptoms. The other change the CDC made regarding fully vaccinated people is around the need to quarantine. The new guidelines indicate that fully vaccinated people who are exposed to someone with suspected or confirmed COVID-19 are not required to quarantine, if they're fully vaccinated, which means it's been at least 2 weeks since their last dose, and they've remained asymptomatic or they have no symptoms since the current COVID-19 exposure. And note that these guidelines also do not apply to non-healthcare settings, and they don't apply to inpatients or residents in congregate care facilities. Fully vaccinated people should still watch for symptoms of COVID-19 for 14 days following a close contact exposure. If a vaccinated person experiences symptoms of COVID-19, they should be evaluated by their medical provider, including testing. Another change is that people who have tested positive for COVID-19 in the last 3 months and who have recovered are also not required to quarantine or get tested after having close contact with someone who has confirmed COVID-19, as long as they don't develop any symptoms. Individuals who do develop symptoms again within 3 months after first testing positive for COVID-19 may need to be tested again if there's no other cause identified for their symptoms. These individuals should be clinically evaluated by a medical provider for COVID-19, including testing. As a reminder, anyone that develops symptoms of COVID-19 is required to isolate according to our Long Beach isolation order. In closing, I'd like to say that although some restrictions will be relaxed in some sectors in the weeks ahead, as the mayor mentioned, please don't become lax in adhering to our health order. We're still in the middle of a pandemic that continues to cause infections, hospitalizations, and deaths in Long Beach. Protocols are in place for everyone's safety, and we must all continue to do our part to reduce the spread of COVID-19. Thank you.
Thank you. I want to also just clarify that our health department's belief here is that we are going to be essentially aligning with the state red tier order. There will be some maybe slight modifications just to ensure some safety precautions that are going to be in place, and that could happen in as early as in the next day. It's really dependent on the state and when we get that approval. So we're waiting on that. I just also want to note that we're not completely. I know the county is still making some decisions about where they're going to end up completely within the red tier, and our decisions on this, we feel so good about our numbers that is separate of that. So we're kind of waiting to hear where the county's going to end up as well. Any questions? Yeah, I think our equity plan, because the equity work is real and it's serious, but our equity plan, I think, is going really well. We've kind of redoubled efforts on the mobile clinics. There's mobile clinics happening all the time now. Every weekend, we've done multiple Latino clinics. We just had one in North Long Beach, I think, this last weekend. They went really well. Targeted clinics with the NAACP or Black churches. And we now have mobile units going to senior homes and going into communities. That is happening now constantly. And so that's a big part of what we do every day, is just different plan for different mobile clinics that are happening. We are aware of what the equity map looks like. And I think, again, we have to be cognizant of the fact that when you focus first on doing your 65 plus population, you're also going to just have to understand that that is a less diverse population in Long Beach. And so as more essential workers come into the mix, those numbers are going to improve also. Any other questions? Okay, great. Well, thank you. We are going to have a Spanish translation for the stream, and appreciate it. Thank you.
Buenos días, hoy es nuestro comunicado de prensa para el 11 de marzo del 2021. Hoy nos acompañó el alcalde García y la doctora Davis, oficial de salud de la ciudad, aquí en Kress Market. Kress Market abrió en el 2010 y fue aclamado como un triunfo en términos de proyectos de reutilización adaptiva aquí en la ciudad. Un verdadero negocio de familia, Kress inició y está dirigido por Javier e Hilda Ortiz. Todos sus empleados aquí ya han sido vacunados y hoy compartiremos una actualización de la vacuna que incluye información sobre lo que hemos hecho para ayudar a personas como los Ortiz. También ofreceremos una actualización de COVID-19 y algo de información sobre lo que vendrá después en nuestra ciudad en términos de reapertura segura, apoyo para pequeñas empresas y vacunas. Al día de hoy, 51,571 residentes han dado positivo por COVID-19. Nuestro promedio de casos nuevos en el punto más alto fue de 740 personas al día. Hoy tenemos un promedio de 31 casos por día, que es una disminución de 96%. También las hospitalizaciones han bajado un 48% y en la actualidad tenemos a 159 residentes en el hospital. Las hospitalizaciones en el área de Long Beach pasaron de 598 en el pico del aumento a 70 en la actualización. Nuestra tasa de positividad también ha reducido drásticamente del 17.4% ahora al 2.3%. Hasta el día de hoy hemos perdido 879 residentes de Long Beach a causa de COVID-19. Cada semana el Estado está evaluando las métricas de cada condado de acuerdo con el plan estatal para una economía más segura. El Estado observa la tasa de positividad, la tasa de casos por cada 100,000 y una tasa de positividad del cuartil de equidad en salud. Las métricas del condado de Los Ángeles, que incluye la ciudad de Long Beach, podrían colocarnos en el nivel rojo menos restrictivo en los próximos días. Nuestros funcionarios de salud de la ciudad están planificando activamente dicha medida y determinarán los cambios apropiados a las órdenes de salud de la ciudad, que podrían incluir la reapertura de algunos sectores con capacidad limitada y modificaciones a los protocolos. Estos cambios afectarán a restaurantes, gimnasios, cines y eventos. Algunos de los cambios van a incluir minoriza abierta en interiores con la capacidad máxima del 50%, museos y acuarios en interiores con una capacidad máxima al 25%, las salas de cine van a abrir en interior en una capacidad del 25% o 100 personas a lo máximo, lo que sea menor. Los gimnasios y centros de fitness, de actividades, abren en interiores con una capacidad máxima del 10%. Los restaurantes también abrirán con una capacidad máxima del 25% o 100 personas, lo cual sea menor. Además, a partir del 1 de abril del 2021, los eventos en vivo al aire libre pueden ocurrir de acuerdo con los requisitos de la orden Más Seguro en Casa. Y eso todo puede encontrarlo, más información y detalles en línea en covid.ca.gov. También la capacidad en eventos al aire libre debe limitarse al 20% de la ocupación máxima. La capacidad en las suites también 25%. No más de 15 personas. Los eventos en vivo en interiores siguen estando prohibidos. Como siempre, seguimos la ciencia y escucharemos a nuestros expertos en salud pública para determinar qué es lo mejor para la ciudad de Long Beach. Se darán a conocer más detalles en los próximos días. Información ahora sobre la vacunación. Continuamos vacunando a tantas personas en categorías elegibles como lo permite nuestro suministro. Y con la reciente entrega de la vacuna Janssen, conocida por la mayoría de las personas como la vacuna de Johnson & Johnson, la ciudad de Long Beach vamos a poder proporcionar más vacunas que salvan más vidas. Y también hemos terminado a vacunar a la mayoría también de educadores y personas en el sector alimentario. El viernes pasado llevamos a cabo una clínica de vacunas gran tamaño en el centro de convenciones para esos trabajadores de restaurantes de Long Beach, empleados de bodegas y mercados, cocineros y otras personas que trabajan en esta industria alimentaria. En este momento, más de 10,000 trabajadores de alimentos han sido vacunados en la ciudad. La semana pasada, el Estado nos permitió expandir las vacunas a los residentes de Long Beach con discapacidades físicas o del desarrollo. También estamos empezando ahora a vacunar a las personas que trabajan en tránsito, empleados de la ciudad, el aeropuerto y también aquellos que trabajan en servicios de limpieza. A partir del sábado comenzaremos a vacunar a las personas con problemas de salud subyacentes de 16 o mayor. Publicaremos información detallada sobre lo que le califica como una condición de salud subyacente, junto con más detalles al final de esta semana. Ahora vamos a hablar sobre VAXLB. Va a haber una transición de cómo usted va a recibir la información de cuándo va a ser usted elegible para recibir esa vacuna. La ciudad ha completado ahora las citas a través de VAXLB para los grupos elegibles y hará la transición a un nuevo modelo de registro en línea. A partir de esta semana, la ciudad hará la transición a MyTurn, trasladado a MyTurno, el sistema estatal de notificaciones y citas de la vacuna COVID-19. MyTurn o MyTurno ahora es un requisito del Estado y está destinado a ayudar a administrar la distribución de vacunas. Todas las personas que se hayan registrado en el sistema VAXLB de la ciudad y aún no son elegibles tendrán que registrarse ahora en el sistema estatal de MyTurn. Puede seguir usando VAXLB para poder recibir información y la información para poder ir a la página de MyTurn. MyTurn, el sitio de web es MyTurn, deletreado myturn.ca.gov o llamando al área 833-422-4255. Como mencioné, la página VAXLB de la ciudad seguirá siendo un centro de información sobre la vacunación de COVID-19. Ahora vamos a pasar a información que ofreció la doctora Davis, oficial de salud de la ciudad, quien habló sobre la vacuna más en detalle, la Janssen, que es de Johnson & Johnson, y nos actualizó sobre las enmiendas a nuestra orden de cuarentena. Janssen es una empresa farmacéutica propietaria de Johnson & Johnson, y la semana pasada la ciudad recibió nuestra primera asignación que contenía 4,100 dosis de vacunas. La vacuna Janssen está aprobada para su uso en personas mayores de 18 años y se ha demostrado que ofrece una gran protección contra la enfermedad grave por COVID-19 y también la muerte. La vacuna de inyección, que es administrada solo una vez, es menos sensible a la temperatura de las vacunas ofrecidas como Pfizer y Moderna. Como ustedes saben, las últimas dos vacunas tenían que ser muy cuidadosamente transportadas debido a sensibilidad de temperatura. Recomendamos a todos que tomen la vacuna Janssen si se les ofrece, porque la mejor vacuna que puede tomar es aquella a la cual usted tenga acceso. Muchas personas se preguntan qué puede hacer ahora que ustedes completan las vacunas. El Centro para el Control de la Prevención de Enfermedades ha elaborado recientemente algunas pautas específicamente para esas personas que han sido vacunados por completo. Estas pautas se van a ser reflejadas en nuestra próxima orden de salud. Para aclarar, se considera una persona completamente vacunada si ha recibido las 2 dosis de Moderna o Pfizer y ha pasado ya 2 semanas, o si ha recibido la sola dosis de vacuna de Janssen y también ya ha pasado por lo menos 2 semanas de su vacuna. Como puede haber escuchado, el 8 de marzo el CDC publicaron su primer conjunto de recomendaciones de salud pública para personas completamente vacunadas en entornos no sanitarios. Estas solo se aplican a entornos privados como su hogar. Las personas completamente vacunadas pueden visitar a otras personas completamente vacunadas en el interior sin usar máscaras ni distanciamiento físico. Puede también visitar a personas no vacunadas de un solo hogar que tengan un riesgo bajo de contraer la enfermedad grave COVID-19 en interiores sin usar máscaras ni distanciamiento físico. Y solo para repasar, las personas con menos riesgo de enfermedad grave son aquellos que son jóvenes y que no tienen problemas de salud subyacentes. Cuanto mayor sea y tenga problemas de salud subyacentes como presión arterial alta, obesidad, diabetes o ser fumador actual, corre usted un mayor riesgo para contraer una enfermedad más grave. Esa guía solo se aplica en entornos públicos, no se aplica en entornos de atención médica. Es importante recordar que las personas completamente vacunadas deben seguir tomando precauciones en público. Use su cubierta facial bien ajustada, practique un distanciamiento físico de aquellos que no son de su hogar, evite reuniones en persona de tamaño mediano y grande y hágase la prueba si está pasando por cualquier síntoma de COVID-19. El otro cambio que hizo el CDC con respecto a las personas completamente vacunadas es la necesidad de ponerse en cuarentena. Las nuevas pautas indican que las personas vacunadas que están expuestas a alguien con COVID-19 sospechoso o confirmado no están obligadas a ponerse en cuarentena si están completamente vacunados, ha pasado 2 semanas de su última vacuna y han permanecido asintomáticos desde la exposición actual de COVID, no tienen síntomas. Y tengan en cuenta que estas pautas se aplican en entornos que no son de atención médica y no se aplican a pacientes hospitalizados y residentes en centros de atención colectiva. Las personas completamente vacunadas deben estar atentos a los síntomas de COVID-19 durante los 14 días después de una exposición por contactos cercanos. Si una persona vacunada experimenta síntomas de COVID-19, debe ser evaluado por su proveedor, incluyendo posiblemente tomar una prueba. Otros cambios en los cuales las personas que han dado positivo por COVID-19 en los últimos 3 meses y que se han sido recuperando no están obligados a ponerse en cuarentena o hacerse la prueba después de tener contacto cercano con una persona positiva de COVID-19 siempre que lo hagan, si no desarrollan nuevos síntomas. Es posible que las personas que desarrollen síntomas nuevamente dentro de los 3 meses posterior a la primera prueba positiva por COVID-19 necesitan hacerse la prueba nuevamente si no se identifican otras causas para sus síntomas. Esas personas deben ser evaluadas clínicamente por un proveedor médico para detectar COVID-19, incluyendo una prueba. Y como recordatorio, cualquier persona que desarrolle síntomas de COVID-19 debe aislarse de conformidad con la orden de aislamiento de la ciudad de Long Beach. Para terminar, queremos recordarles que aunque algunas restricciones ya se han hecho un poco más flexibles en algunos sectores, no se relaje en adherirse a nuestra orden de salud. Todavía estamos en medio de una pandemia que continúa causando infecciones, hospitalizaciones y muertes aquí en la ciudad de Long Beach, el estado y por todo el país. Existen protocolos para la seguridad de todos y todos debemos seguir haciendo nuestra parte para reducir la propagación de COVID-19. Eso es todo por hoy. Muchas gracias por acompañarnos. If you've joined during our Spanish translation, please visit our Facebook page to see the press briefing from the beginning with Mayor Garcia and Dr. Davis. We thank you for joining us.